Thank you. Good morning, everyone, and welcome to our Healthy Start Work Group meeting. I am going to turn it over, as usual, to our lovely Dr. Cooper to give us our official welcome. Dr. Cooper?
Good morning, everyone, and thank you so much for joining us today. If you have the opportunity to do so, please type in your name and the organization in the chat. And please note this meeting will be recorded. So we look forward to a spirited and fruitful conversation and discussion. So thank you again for being here. As far as the meeting agenda, what we're going to do is we're going to go over a few items. One, going over the welcome and the agenda review, which we're doing now, our icebreaker, and of course, the PGHAC updates, reflection of fiscal year 26, looking forward to our discussion and planning for the next fiscal year 27, looking at the planning polls, and actually evolving our discussion around that, and looking at proposed missions, our mission statement, vision, and value statements as well. And then that will lead us into our community announcements and upcoming meetings and adjournment.
Awesome. Thank you. All right, Annie.
So hi everyone, I'm Annie Oli, and I know some of you from other forums, but I'm looking forward to getting to know everybody a little bit better. So for the icebreaker today, because it's 1,000 degrees, maybe 100, but it feels like 1,000 to me. We would like for you to, in the chat, put your name and your organization, and I see folks have started to do that. And then what's one thing you're most excited to do this summer? And I will just start. One really fun thing that I've started to do lately is take dance classes again. I did dance as a child and a teenager and loved it. And then for some reason decided to take a 25-year break. But I've started up again and it's been really amazing. So that's my contribution.
Yeah, thank you. Looks like we've got some comments in the chat. Anya, summer finding new places to thrift. Yes, let me know what you find. Please share the knowledge.
Oh, you're going to Sean, you're going to St. Martin. I was there earlier this year. It's beautiful.
Oh, do you have any recommendations?
I mean, if you can get to Maho Beach, it's you know, you're not put off by jet fuel. It's pretty amazing.
Awesome.
But really, I mean, you know, the beaches are beautiful. The mountains are also really lovely. So
amazing. Yeah, I just got married last weekend, so it's for my honeymoon.
Congratulations.
Oh my gosh, congratulations.
Thank you. I got the ring on. Yeah, I'm so very excited about that. But also, I want to really go to El Salvador. My mom is from there, and I've never been there before. So, Jessica, I hope you have a wonderful time there.
I love that. That's so exciting. We should have had cake, virtual cake. Congratulations.
Let's see what else have we got here? My goodness. So lots of fun vacation plans. We got another wedding. Jen, I see your son's getting married. That's wonderful. Jen's my buddy from my other work. So let's see. Ooh, happy birthday, Latasha. Sharon, you got your family reunion. That's exciting. Lots of family stuff. We just spent 10 days traveling to see my husband's family. We met folks that I haven't met yet, even though we've been together for a really long time. That was fun.
That's so cool.
Let's see. Benita, what's hand dance? I don't know what that is.
Oh, it's a lot of fun. You always in hand dancing, you always have a partner.
Yes, okay. And coordination. You got to have good coordination too.
Yeah, you got to have good hand and feet coordination to make it go well. So it's been fun learning.
You'll have to do like our little like movement activity for our next in-person meeting. Teach us the
Oh,
hand
that would
dance.
be awesome.
That's
I
so
love it.
cool.
Let's see. Okay. Patrice, congratulations on the upcoming arrival of your second grandchild. This is all very exciting.
That's really cool. Well, thank you all for sharing a lot of travel, a lot of things to celebrate, marriages and babies and all the wonderful things. This is just it just feels like a great summer because of all of this. So thank you all for sharing. This is awesome. And thank you, Annie, for leading that icebreaker for us.
Absolutely.
All right. For those who haven't shared yet, continue to throw your comments in the chat. We are happy to read them all. Let's see. All right, and I'm going to turn it over to AJ for a few quick updates. AJ?
Up here. But want to start off with a few announcements. We're continuing to move forward with the chip draft. So we're finishing up that first draft now. It's honestly looking really good, which includes pulling together that feedback priorities, especially the action plan and details that have come out of the different work group conversations. So we really appreciate all the insights you all have provided and our many, many different meetings before our chip. We know we had quite a few, but honestly, you all helped us push it over that finish line. So really appreciate you all for that. Once that first draft is complete, it will go through an initial review process with the OAP team and co-chair leadership. And that's just to ensure our goal of making sure the final chip reflects the work priorities and voices of each work group. So that is regarding our chip draft. Second, we're going to be beginning to think through that implementation plan, right? So as we move from planning into action, we want to make sure that our strategies are as realistic, collaborative, and connected as possible, especially to our partners and resources already represented across PGHAC. So today's discussion will essentially help support that next phase, especially as we reflect on FY26 and begin planning for FY27. Third, I got one more after this. Third, PGHAC is also updating its membership process. So we have a new membership form to help us confirm and really just help us better understand how members would like to stay engaged moving forward. We'll discuss that a little bit later, so I won't spoil anything right now, but we do encourage everyone to complete the form when they have the chance. And lastly, we are also working on updating our PGHAC's Articles of Collaboration, which will serve as the coalition's bylaws. So this is part of our effort, again, to strengthen that structure of the PGHAC roles and overall operations of the coalition as we move into the next phase of work. And with that, turn it on back over to you, Shanae.
All right, we're actually going to turn it over. We have an exciting announcement. Dr. Cooper, would you like to give our official introduction of our new co-chair?
My pleasure. Good morning, everyone, again. And I would like to introduce you all to Annie Ollie. Annie is going to be our co-chair, as Shanae had said. Annie brings 2 decades of public service and a wealth of knowledge and experience in public health and public health operations. She currently serves as the Senior Manager for Maternal Health at Primary Care Coalition and leads the Integrated Maternal Health Services Quality Improvement Project, which is going to be very beneficial to what we're doing with our work group. Ms. Ollie has extensive experience in government and nonprofit organizations, including the U.S. Food and Drug Administration, the Association of Public Health Laboratories, and the Maryland Department of Health, in which she played significant roles in responding to the COVID-19 pandemic, managing agency-wide legislation and regulatory affairs, and directing the Maryland Department or Health Department's healthcare system. Please join me in welcoming Annie as our work group's co-chair.
Welcome, welcome.
Thank you. And thank you, Dr. Cooper, for that intro. It's a pleasure to be here and work with all of you. I've really loved my time on the work group. And as I said, I know some of you from other things, and I know how dynamic everyone who is here is. And I'm just really looking forward to coordinating all of these efforts, which are so important and we're so dedicated to. So thank you again.
Love that. We're happy to have you on board. All right. Well, this meeting, we're already 11:15. My goodness, we have so much to cover today. But thank you all again for being here. I think this is the largest attendance we've had this month out of our work groups given the summer. So I really appreciate you all just taking the hour to be with us. And so I was thinking recently, 2 days ago on the 14th was my official 1 year mark with the health department and with the coalition. And I was just really kind of overwhelmed and just excited about that and just the transition. And I'm just so grateful. Thank you. Just so grateful to meet all of you amazing partners, to learn from you all, to work with you all and our incredible co-chairs, really just to strengthen the coalition because it was amazing before I got here and we're just making it even more amazing. And then all the work that we're doing to develop the chip. And so as last year ends, we are officially in the new fiscal year. I just thought it would be really valuable to spend a little time reflecting together. So I really want today's conversation to be about, looking at what worked well, where we can improve in some areas, and then talk about ways that we can help shape some of our meetings and engagement activities for the new fiscal year, especially because now we're done all the planning stuff. Now we get to go into the implementation and the heavy lifting work with our community health improvement plan. So I really want this coalition to work for all of us. And I can't do that if I'm the one making all the decisions, right? It takes a village, it takes a team, and I really want this to be a collaborative effort. So I want to start with what we're going to call our glows. So these are the things that you think we've done well as a coalition, or maybe even as a work group. I know Healthy Start has only been in existence since February, but we've done a lot in our few short months together. In comparison to the other work groups that have been around for a while, we've done everything they've done in much shorter time. So that's something to really be proud of. And so just a couple of questions and we can open the floor, the room, we can utilize the chat as well. Just what are some accomplishments that you're most proud of when you think about your participation in this work group, in the coalition, and what are some things that you like to see us continue doing into this new fiscal year? There's no wrong feedback. I'd love to hear it all.
I guess I'll start. I like
Can
the
I
way
go?
that.
Oh.
Yeah, please go.
I just wanted to say hi. I'm new here. I have not done anything with the coalition, but I'm so excited to have found out about you all. I don't know if she's on the call, but oh my gosh, Miss Cotillo, I think that's her last name. Lisa told me about you all. I'm Latasha. I work with Food for Maryland. We're a nonprofit that does home delivered meals to those in need. Currently up and down Maryland from National Harbor all the way up to Baltimore City and County. So I just wanted to come on and introduce myself because a lot of the participants we have right now have Medicaid, and a lot of people don't know that if people are in a specific situation or circumstance, Medicaid will actually pay for them to not only get home delivered meals, but to also get caregiving services. So I just want to spread the word and information so people can know about that.
I love that. Well, welcome. Thank you so much. And please, I'll make sure you get our email so that way we can set up a quick partner meet and greet because I'd love to learn more about what you're doing and how we can work together with the coalition, how the coalition can help you. That's awesome. Thank you so much. Any other feedback?
I just love the way that the group has come together as a collective asset to this particular work group, and the diverse insights we bring not only the medical community, but we bring, institutional health literacy, and all these people working together for a common goal. And as you mentioned, Shanae and AJ, you all have been absolutely terrific. But how we were able to come together to identify what the needs are and how we can fill those potential gaps, and how we're looking forward. And I think these actionable steps are going to, be true testaments of what we have and will continue to accomplish. And the more diverse insights that come to the table will help, again, allow us to contribute to that knowledge and advance all these particular initiatives that are going to bring about better outcomes.
Love that. Thank you.
So thank you, everyone.
I would just echo that and also say, I think we are really on the way to, making connections and, making sure that everybody knows what's going on in Prince George's County and also statewide, as we just saw, someone new. So welcome very much. But, come on board, it says something, everyone's like, oh, like my folks need this, right? I mean, that's the magic of groups like this, I think. And I'm just really excited to see how we can break down silos, and make sure that folks are aware and, are able to access all the wonderful resources that are available, in this group and also, in the county as a whole.
I love that. Thank you so much. Any other thoughts or comments? I can't see the chat, so if there's any comments in the chat, would one of the co-chairs read that for me, please?
Yes, I entered into the chat the recent legislation, Maryland House Bill 118, and it's health insurance and health occupations, perinatal behavioral health conditions. And because we're looking at wraparound services when we're part of this group, I think it's also important, and I think we've integrated that throughout this whole journey, that we understand that there's legislation out there that's going to help us to advance what we're trying to accomplish. And we are, what I like to say, change agents and conduits to our legislators. And they're expecting us to be able to fill them or provide them information that best describes the needs of the community so that they can basically pass House bills that are going to help fulfill those particular gaps or bridge those gaps.
I love that. Thank you, Dr. Cooper. All right, well, let's go ahead and move on to our second question. And AJ, I think there's a poll to this, so if you don't mind launching that. So one thing we know is that everyone here is volunteering their time. We all know you have regular jobs, you have other duties and responsibilities, and we truly appreciate the time that you make for us. So we'd love to know, in this past year or the past few months that we've been in existence as a Healthy Start work group, what has made participating in this work group worthwhile for you? Is it building the partnerships, the connections? Has it been learning about the resources, helping shape the chip, community engagement? What has been most valuable to you? And if you are outside of the network and can't access the poll, I've put the question and the responses on the slide, so you can type your response in the chat and we'll make sure to have that noted. You can share aloud as well. I'm looking at some of the votes coming in. Looks like networking, building partnerships, learning about resources, contributing to the chip, community engagement. Got some health equity. Love that. Professional development. Awesome. Information sharing. Yeah, this is good. Awesome. Okay. Yeah, this is great because this question is important because it helps us know what was most valued this past year, but also what we should continue doing in the new year. We're in the new fiscal year, but as we continue our work, especially over the next 3 years with our chip, but just the things that you all really appreciate. And if there's anything that you want to see more of, we want to know that too. Because again, we want this coalition to benefit everyone. And is there a comment that popped up? I think I saw a little notification. Oh, yes.
Shanae, I think it's just Latasha very kindly offering more information about her,
awesome. Okay.
her program.
Okay, thank you. Awesome. All right, so now let's shift to our grows. We talked about some things that went well. Let's talk about some areas of improvement. And I think every organization has an opportunity to improve, and we're no different. So we really want to gather your feedback to really help make sure that these meetings especially are worth your time and that this coalition is really continuing to meet your needs. So again, I'd love to hear from you all, and we can open the floor for discussion or to the chat. What would make your experience as a coalition member even better? what would improve your experience here? What would make meetings feel more valuable or more worthwhile? Because again, we know you're taking time out of your day to volunteer your time and expertise with us. So what could make this even better or more worthwhile for you all? Involve more community members? Yes, I agree. And we are working on that. We have a plan for that. So I love that.
I'll go ahead and share. I haven't been part of this particular meeting. I've been in a couple of the other work group meetings and had some staff members join those as well. But in terms of two things, maybe, I don't know if you guys do have in-person meetings, maybe quarterly or once every blue moon. I do love, in person and really getting to know each other and what we all do. And then two would be just any advocacy opportunities, going to, county council or Capitol Hill or Annapolis, whatever it may be. I think at least I know my company, we're willing to help show up and advocate and try to make some policy changes. So I'll leave it at that.
Thank you so much. And so to answer your question, yes, we do have quarterly meetings. We have 4 quarterly meetings where the coalition meets as a whole, and those are in person. So more to come on that. But we'll make sure, if you're not already on the listserv, we'll make sure to get you on that so you can have access to all the information regarding those meetings. So thank you. And I have your note about advocacy opportunities. So thank you for that.
Thank you.
Jessica, directory of members. Yep. So that's actually also a part of our membership application, the new one that we've just recently launched. So more to come on that as well. We'll talk a little bit more about that later. So thank you for that. And a resource and contact. Yep. We're here. We're all on the same page. I love that. Awesome. Okay. Thank you all for your feedback. And in that vein, one thing we do strive to do is not only increase our coalition membership as a whole in the sense of numbers, but also the quality of our membership. Really, we want to enhance participation for those already attending. Again, we know life is busy between work, family obligations, traffic, competing meetings. I know we're all balancing a lot. And so we really want to better understand what barriers you may come against that may prevent that consistent active participation. So what are the biggest barriers that make participating difficult, whether that's for our monthly work group meetings or our quarterly meetings? And this is another poll, so AJ, if you could launch that for me. Oops. Not, let me see. Uh-oh, did I lose them?
No, it's not. It's not opening. There we go. Should be good now. There we go. It's live. Sorry about that.
Gotta love technology. All right, so what barriers may make participation difficult? Some of us may have meeting fatigue. There's just way too many meetings, maybe the time of day. Let's see, it looks like we have scheduling conflicts, too many meetings, meeting fatigue. Looks like we're all on the same page. Okay. Very good. Let's see, we have some more responses, scheduling conflict, the meeting length, limited opportunities to contribute, lack of follow-up. Okay, got some other. Great, this is all really helpful because again, we want to structure these meetings to make them work for all of us. So this is really great feedback. I really appreciate that. And you can continue to vote even as we continue our conversation. So thank you all so much for that. All right. So again, thank you all for sharing those reflections. We've looked back and now let's look ahead. And so your feedback with this part of the meeting will really help kind of shape how this work group operates in this new fiscal year, especially as we shift from planning the CHIP to actually putting it into action. And so we'll cover some discussion around the work group structure and meeting cadence. We'll talk a little bit about coalition growth and partnerships. We'll also talk about the new membership engagement structure that we have, and then close with our mission, vision, and values feedback, which is really important because that's going to reflect who we are and the direction that we're going with the coalition. And so we want to start with our work group structure, specifically our meeting frequency. Healthy Start currently meets on a monthly basis. This was incredibly helpful again during that planning phase for the CHIP because we had to cover a lot of moving pieces. And it really helped us get some opportunity to learn about what some of our partners are doing in the community and how we can all collaborate together to contribute to this effort. And so now that we're entering this implementation phase, we want to make sure that our meeting schedule continues to support this work and that it still works for all of you. So what do you think? Is this something that we should continue doing as far as meeting monthly? Should we consider bi-monthly, or are there other options that we should consider? And again, the poll is launched. You're welcome to respond in the chat or to share aloud what your thoughts are. Looks like we're neck and neck for monthly and bi-monthly. Okay, got it. Sean, I see your comments. Thank you. Marlene, I see your comment. Thank you. Awesome. All right, thank you. This will help us shape our meeting cadence, and whatever changes are made, we'll make sure to communicate that well in advance to you all. So thank you so much for that. Kind of along the same lines, let's talk a little bit about meeting length. Some of us have a bit of meeting fatigue. Some of us mentioned that some of the barriers were length of meeting or meeting frequency. Right now we meet for an hour. And we cover a lot in the hour, but I just want to check in. Is that enough time for discussion? Would 90 minutes work better? Should we consider a different option? I think one of our work groups currently meets for an hour and 15 minutes, so like that 75-minute mark. So what are your thoughts? Should we continue at the hour, consider something else? Okay. See the responses coming in. Seems like the hour works for most. Marlene, I see your comment. Thank you. Okay. Dr. Cooper, I see your comment. Thank you. Yeah, the goal here is really we want to strike the right balance between making progress and respecting everyone's capacity and their time. So it's really important to kind of know what works best for everyone. So thank you all for this feedback. And then the last thing we want to consider is our monthly meeting format. So with our work groups, the work groups tend to meet virtually. And as I mentioned to Sean earlier, our coalitions meet quarterly in person. So when it pertains to just the work group meetings, so just our monthly work group meetings, what format do you all think would encourage the strongest attendance and engagement? Should we continue virtually? Should we consider in person, maybe hybrid? Open to your thoughts. Sean, I see your comment. Hybrid would be nice. Thank you for that. See some. Thank you, Latasha. See some other comments for virtual, hybrid. Marlene, I see your comment. Thank you. So this is great, Dr. Cooper. Thank you. So, this is really cool. Structural changes to the meeting and make sure to communicate in advance. So thank you for this feedback. So this is pertaining to our monthly work group meetings. This is pertaining to our quarterly coalition-wide meetings, okay? So again, our coalition-wide full quarterly meetings, they're designed to bring all of our partners together for a chance to share updates. We have some networking activities involved so we can talk to one another, learn from one another, and really try to stay aligned around those shared priorities. So as we continue to strengthen our participation and as we consider trying to reduce the barriers to engagement, we want to be equitable, of course. We are exploring whether the current meeting time best supports our diverse membership. So currently, we do meet for those quarterly meetings in the evening from 6 to 7:30 p.m. And attendance has grown just in the year that I've been here, which is fantastic. It makes me so excited to just see the momentum and the excitement and just to see the growth in the room. It really just makes my heart so warm. But we know that there's still room to make these meetings even more accessible. So again, we want to hear your thoughts. Would holding our quarterly coalition-wide meetings during regular business hours make it easier or be more accommodating for you all to participate? And if so, what time of day? So we have that morning option, like around 10 to 11:30, we could provide breakfast. We have that midday option where we provide lunch to you all. That post-lunch time, maybe that 2 to 3:30. We could continue the evening with dinner, or maybe you just don't really have a preference. What are your thoughts? And as it pertains to the quarterly meetings, we are asking all of our work groups. So we'll take feedback from all work groups and make a decision based on that. Marlene, I see your comment. Thank you. I see some morning, midday folks, some no preference. Okay. Awesome. See some evening. Okay. It's a pretty good mix. Pretty good mix. Okay. Jessica, I see your comment. Thank you. Awesome. Okay. Again, continue to provide your feedback. Thank you all so much for this. And again, we're gathering this feedback from all of our work groups and we'll adjust accordingly. There's even been some talk about kind of like fluctuating the meetings as it pertains to maybe the location, going to one partner location, then another, doing one time a day versus another. So we'll kind of weigh our options, gather all the feedback, and then make a determination. So thank you all for that. And with that in mind, we do recognize again there are barriers to attendance at these quarterly meetings. I know in the evening it can be a little tricky just because of traffic on 95. Anytime after like 3, it can be a little tricky for some. That commute time can be a little tricky. Work schedule, some of us have caregiving responsibilities, competing meetings, other commitments. So we want to hear from you. What are two of the biggest factors that influence your ability to participate in those quarterly meetings? Is it the time of day, the length of the meeting, format? Again, we could consider maybe a hybrid option for this. Traffic, transportation, what are some of the barriers to this? AJ, you can launch that poll as well, or you can comment in the chat. Sean, I see your comment. Thank you. So I see time of day can be a little tricky. The commute can be a little tricky. Work-life balance, family responsibilities. Marlene, I have your comment. Thank you. Okay. The format. Yep. Awesome. Thank you all for this feedback. This is great. All right, great. Again, we'll take everyone's feedback and we'll make the best determination for the group. But thank you all so much, and we'll be sure to communicate those changes to you, if any. All right. So one thing that's really important to me is making sure that there's room at the table for everyone. You all know I talk about I want to make sure everybody has a meal, everybody can eat, right? So we have a wonderfully diverse coalition. We have nonprofits, government agencies, private practitioners. We've got some school system people. We've got a little bit of everybody. And we want to continue growing. We also want to make sure we're hearing from sectors and communities that may not yet be represented, or maybe they're not represented as well. Dr. Cooper, I know you mentioned having more engagement with community members, right? That's something that we don't see a lot of with this LHIC, and actually don't see a lot in a lot of LHICs, but we want to be very intentional about getting some more of that feedback and more of that engagement. So I want to hear from you all. Who do you think is missing from our table? Are there organizations, specific community leaders or sectors that we could be recruiting, re-engaging, reconnecting? Any thoughts? This isn't a poll. We can open the floor for this conversation. Sorry. Yes, Sean, we do have FQHC staff here on in this work group and in a couple of our other work groups as well. We can always have more. So if you have any personal connections, we're happy to reach out and have those conversations. Okay, any private health care providers and insurance providers? I agree. Thank you for your comment. Yeah, we want to get some of the MCOs involved as well. So if you all have connections, please reach out. Let me know. Do introductions. I'm happy to meet everybody. We've got time. We want them with us. Any other thoughts? Hey, WellPoint. Love it. Hey, UHC. See, representing. I love it. I love to see it. Marlene University, Maryland Extension. Awesome. Yes, I'm writing that down and I will follow up with you about that. Thank you for that. Any other thoughts? UMMS, University of Maryland Medical System. Got it. So many
I'll be reaching
acronyms.
out to them next month.
Awesome. Thank you. Feel free to loop us in. We're happy to have those conversations. This is great. Thank you. And as other ideas come to mind, again, please feel free to shoot me an email, send an email to the PGHAC account. Like we're ready to get the ball rolling to grow this coalition. I know something I always kind of tell AJ, like, I don't care about the numbers, I care about the quality. It's quality over quantity. So, if our list goes, if we only have 100 partners, but they're quality partners, I'm here for it. Like I really just want to make sure that we are making an impact in our community, that we're being effective with what we do. So I love this. Thank you all so much for this insight. All right. And so as our coalition continues to grow, we also want to make it easier for people to participate in ways that best fit their expertise, their availability, as well as their capacity. And so that's why we've officially launched our new membership form and introduced 3 different levels of engagement. So some of you have already completed that form and you would have seen that question. But these different levels of engagement, they're intended to provide flexible ways for our organizations and residents to participate in ways that are a bit more meaningful to them, while also strengthening that accountability as well as that implementation support that we need for the chip. So some members may simply want to just stay informed and stay connected, learn about what's going on in the community and in the meetings. That's totally fine. Others may want to stay informed as well as participate in work groups like you all are doing. We'd love to have that too. And then there are others who may want to do a little bit of everything, right? They want to stay connected, they want to be a part of the work groups, and they want to help with our chip implementation. We welcome it all. Again, we want this coalition to work for you all. So however you are able and willing to offer your support, we are willing and happily ready to accept it. So AJ is going to share a little bit more about that form in our community announcements, but I just wanted to provide this quick snapshot to you all so it wasn't foreign when you do complete that form. All right, but this is really just going to help us stay organized and make sure that we're keeping everyone connected in the right ways, because we know a lot of emails go out and sometimes there's email fatigue, but we want to just make sure that we're engaging with all of our partners in the way that best suits you all. So thank you all for that. And now I'm going to shift quickly to something that's really foundational for our coalition, and that's our mission, vision, and values. So over the past year that I've been here, I've seen this coalition, again, is continuing to grow. The momentum that we're building is astounding. I'm so excited about it. And in that same vein, like I took the first 6 months to kind of watch and see how things are done, and then started making some changes along the way. And so I'm really just trying to better refine the direction of this coalition. And especially as we've developed our new Community Health Improvement Plan, or our CHIP, we've also taken the time to really reflect on, who we are as a coalition, who we want to be, and where we all want to go together. So all the comments and conversation and discussion that we've had in all of our work groups, even in planning for the CHIP, we take all of that feedback. We review the transcripts. We're taking notes. I got Post-its all over my office of things that really just stood out in conversation. So I don't want you to think these conversations are in vain. They're absolutely not. We're really absorbing everything and trying to make adjustments as needed. So our mission and vision and values, they're more than just statements on a piece of paper or on a slide, right? They really help guide our decisions. They help shape our priorities, and they really help to serve as the foundation for who we are and how we work together to improve the health and wellness of Prince Georgians. So as a part of our strategic planning process, the coalition leadership team, we've drafted some updated mission, vision, and value statements that we believe better reflect the coalition's evolving purpose and future direction. But again, we don't want to do anything with just our thoughts and input, right? We want to hear from you all. Again, this is your coalition, and your feedback is so important because these statements should represent the collective voice of this coalition, not just the leadership team. So we invite you all to scan the QR code. The link is hyperlinked on the slide, so we'll make sure to send that out post-meeting. But there's a short survey. Take just a couple of minutes to look at and complete, but we'd really appreciate receiving your feedback. I think August 1st is our deadline. So I thank you in advance for helping us really just shape the direction of this coalition. So thank you all for that. And I know we kind of went through our questions quickly, but I wanted to make sure we got everything in our hour. But before we wrap up, I do have one last question for you all. We've talked a little bit about where we've been, what we've accomplished, where we're going, ways we can make some improvements, how we can adjust the meetings, and how we want to work together moving forward. So if there is one thing that the PGHAC should prioritize this year to remain impactful, to remain action-oriented, to be inclusive and equitable, what would that one thing be? In your opinion, if there was one thing that we should prioritize this year to remain impactful, inclusive, and action-oriented, what would it be? Yep, we've got that in our action plan. Yes, Sean, thank you. I love how we're all on the same page with a lot of things. This is great. I love that. Sean says organizing 1 or 2 community resource fairs together. Any other thoughts or comments? I know we've had some conversation across work groups about training and all kind of getting on the same page as far as like health literacy and outreach to the community. So we've got some trainings in the works with Marlena's team. So we'll be talking about that. Focusing on concrete action steps. Yep, Annie noted that is to come. Presenting concrete actionable recommendations to county council. Yes, love that. And if you all have connections there, please again let me know. I've only met one person so far, and he's new. So it would be helpful to have some established connections as well so we can really get in the door there. So thank you. Advancing health literacy. Yes, Marlene, I agree. Yep. Trainings to come. I'll be reaching out soon. Any other thoughts? Awesome. All right. Well, thank you, everyone. Oh, got your note. Thank you, Sharon. Thank you, everyone, for your feedback and your thoughtful insight. As always, we will consider everything you've all shared today as we finalize our work plan for this year and then begin planning for our CHIP implementation. And with what we have 10 minutes left. Awesome. I did that. Yes. Okay. I'm going to turn it over to AJ to share a few community announcements with us. AJ?
Thank you, Shanae. Our first announcement, is an exhibitor opportunity from the Southern Maryland chapter of the National Black Nurses Association. They are currently looking for exhibitors, so this may be a great opportunity for organizations that would like to share resources, promote their programs and services, or connect directly with community members. Organizations that are interested should complete the required online registration form by 6 p.m. on August 15th. There's also a $25 exhibitor registration fee. For questions or additional information, reach out to the contact information listed on the slide. Our next announcement is the MEI Faith Fest 2026. It's going to be a free event that is open to the entire community. Come and enjoy a day of connection, resources, and community care for the whole, family. This event will take place on Saturday, August 15th, in Greenbelt, Maryland. Vendor registration is also available, so organizations may have opportunity to participate, share resources, and connect with residents during the event. For more information, you can reach out to the contact information on the slide, and all of these slides will be shared post the workgroup meeting as well. Our next announcement is the 2026 Multiple Melanoma Research Foundation Washington, D.C. Walk. The walk will take place on Saturday, September 26th at the National Harbor. The official walk start time is still to be determined. But anyone who is interested in participating can complete the registration form online. Additional information and the contact form are also available through the event website should you have further questions. So this will be a great opportunity to come together, raise awareness, and support individuals and families affected by multiple melanoma and to contribute to that continued research. So please come check it out if you are able. Next up, we have the Greater Washington Region Heart Walk. That will take place on Saturday, November 7th, 2026. This event is brought to you all by American Heart Association. The event will open at 8:30 a.m. and participants can register online using the information provided on the slide. And for general event questions or for questions regarding sponsorship opportunities, we have that contact information listed on the slide. So please consider participating or sharing this event. Next up, we have the University of Maryland interview outreach request. So the University of Maryland is also requesting support with participant recruitment for a public health study. The research team is looking to interview participants as part of a study designed to help develop a teaching tool for public health students. So this could be a cool opportunity for community members to share their experiences and contribute to the education and preparation of future public health professionals. Again, that contact information is on the slide. Please feel free to reach out to Jenna Yang if you have any further questions. And last but certainly not least, we have the Maryland Medicaid Education and Navigation. This is offered by Coaching Salute Holistica in partnership with Maryland Physicians Care. They are helping individuals and families throughout Maryland better understand Medicaid and access available resources. Their team can help residents learn whether they may qualify for Medicaid, understand the application and renewal process, learn more about Maryland Physicians Care benefits, and connect with trusted enrollment partners for additional assistance. Anyone interested can complete the form shown on the slide to get connected. For questions or direct assistance, residents can call Coaching Salute Holistica. Please feel free to share this resource with residents, clients, or families, especially those who may be LEP, limited English proficient, to help them better understand their coverage and navigate the Medicaid process. And with that, Shanae, back over to you.
Thank you so much. Clearly, there's a lot going on, even in the summer, right? The work never stops. I love that. All right. And then as we mentioned earlier, we have our new PGHAC membership form, which went into effect the 1st of this month. So we are asking all of our current PGHAC members to complete this form so we can make sure we have the most accurate and up-to-date information for everyone. For those who are interested in learning more about the coalition or being a part, again, complete this form. We're happy to set up partner meet and greets with you all so we can learn more about your organizations and we can have that discussion around how the coalition can be a benefit to you all. But this will really help keep our membership records current, improve our communication, better connect with members, better connect them to the work groups, to any updates and engagement opportunities to match their interests and their capacity. I also want to clarify that this is different from the directory survey that was going out last year. The directory survey was more focused about gathering more information about the organizations as far as the services provided in the areas that they serve. This new membership form is more focused on that membership and engagement piece. Again, this helps us confirm who's actively involved, which work groups people want to participate in, and that level of engagement. You remember the 3 levels that I mentioned earlier. It helps us identify what works best for you all. So again, to remain active, we're asking all of our members to complete this form. I think we were talking about August 1st being that initial deadline, but it's a rolling form. So, please fill out and we'll get you re-engaged. It's all good. So yes, please make sure you scan that QR code. Again, the link is a hyperlink, so you can click within the slide after we send that out. Are there any other partner announcements at this time? Sean, I see your hand.
Yeah, I'll try to be as quick as I can. Well, 2 things here is we have 8 different people here, all different languages that are certified, trained through Maryland Health Connection to get people enrolled in health insurance, whether it's Medicaid or private health plan with financial assistance. Granted, you have to be working at least minimum wage to get that financial assistance, but now's the time, especially for a lot of immigrants who might have work permits, who are working at least minimum wage. Now's the time to get enrolled up until, I know there's open enrollment, but things are going to change in October once again. So it's going to get harder to get health insurance with financial assistance. Second note is we have launched a litany of different training programs this month in July, ranging from Spanish HHA certifications to CompTIA Tech Plus to QuickBooks training to English classes and more. All of our classes are free online about twice a week, so it does require a laptop and internet connection, but totally free training, and we will also pay for that exam, and it's a really good upskilling opportunity. So I will put my information in the chat if anyone's interested, and I'll send flyers after the meeting.
Please, thank you so much. Thank you so much. What an awesome opportunity. Annie, I think I see your hand.
Yes, I put the information in the chat as well, but I am currently recruiting for the Integrated Maternal Health Services Initiative Patient, Family, and Caregiver Advisory Group. We are just about to start with a new cohort. So this is an opportunity for individuals in Maryland, but specifically in Prince George's County as well, to share their experiences in both their prenatal and postpartum care, as well as to provide feedback and patient-centered expertise on how care is coordinated in Maryland, both through their experience and what they'd like to see. It's a really great group. We keep it small. We have meetings facilitated in English and Spanish at the moment. We're looking at adding more languages. And hopefully, best of all, we provide a $100 gift card incentive per hour participation, and we round up, right? So if it's an hour and 15 minutes, it's 2 hours of participation. So if you know anyone who would be interested, I did provide the email address in the chat, and we would love to have folks be part of it. So thank you, Shanae, for that.
Yeah, of course. That's awesome. All right. A lot of exciting things going on. So this is great. Sean, I'll definitely follow up with you as well as Annie to get that information, and we'll share that out to the coalition. And with that, here is a quick snapshot of our upcoming work group meetings for the remainder of this quarter. We will break in August for the summer. Again, many of you are traveling, so we want to honor that time, and so you all can enjoy that with your family. And we will resume in September with our new identified meeting structure and cadence, if that seems to have been any changes to that. Again, we'll make sure to communicate that to you all in advance. And yeah, for those who complete that membership form, if you identified any additional work groups you want to participate in, we'll make sure to get you connected to those as well. And then with that, as always, thank you all so much for just your engagement and your thoughtful feedback, for the time you spent with us today. I do not take it for granted. We truly value your partnership, and everything you've shared will help shape how we move forward as a coalition. So again, we're just super excited to begin this next chapter with you all together as we transition from this planning into action. And we hope you have an amazing rest of your day, the rest of your summer, and we look forward to seeing everyone in September. Have a great day, everyone. Stay cool and hydrated.
Thank you. You
Bye.
too.
Thank you. Goodbye.
Thank you.
Bye.
Bye.
It's just us. Hold up. Let me stop the recording. Hold on. And